My name is Diego Reyes, functional health coach, functional nutritionist, owner of Complete Vitality Functional Health Coaching Organization. I have helped transform hundreds of lives, men and women, by getting to the root cause of their chronic health issues, optimizing their hormones, gut, and metabolism so they can lose the weight and keep it off long term. Do you deal with brain fog, fatigue, depression, anxiety, those type of symptoms, and above all, weight struggles? Your thyroid gland could be to blame. Now, no matter if you know anything about thyroid or you have a full-blown thyroid disorder such as hypothyroidism or Hashimoto's, this video will be of help for you. In this video, I'm going to uncover the truth about thyroid problems, thyroid conditions. As someone who's helped hundreds of women, particularly, reverse their chronic thyroid conditions, I come with clinical experience, research, knowledge, and expertise on this topic. See, over 12% of the United States population develop a thyroid condition during their lifetime. Up to 60% of individuals with thyroid disease are unaware of their condition. That means over half of thyroid conditions go undiagnosed because the individual does not even know that they're dealing with a thyroid issue. One thing you should know, your thyroid, located above your Adam's apple, speaks to every cell inside your body, but we just blow it off. The most common cause of hypothyroidism is Hashimoto's thyroiditis, but you may never know this because your endocrinologist or primary care physician never test a full thyroid panel. They just look at TSH and T4 and then send you out the door if it's normal. If it's out of range, then they'll diagnose you with hypothyroidism. But even if you do deal with hypothyroidism, you could have Hashimoto's because they're not testing a full thyroid panel. But there's also other things. 1 in 8 women will experience a thyroid issue in her lifetime. Okay, and hypothyroidism is the second most common endocrine disrupting disorder in women of reproductive age. If you're someone dealing with a thyroid issue, you know what it feels like. You feel unheard. You feel like the weight never comes off. The weight just comes on. The energy is just low. You have bad anxiety, and you're not alone. But it's because we're addressing the problem all wrong. Conventional Western medicine, your endocrinologist, primary care physician, are standard medicine protocols is the exact opposite of what we should be doing. See, just taking levothyroxine or Synthroid or some other thyroid medication is not fixing the root cause. Thyroid MP, Cytomel, Armour, Triason, levothyroxine, Synthroid, those are thyroid hormones. But those hormones have to convert into the active form depending on which medication you're taking. Majority thyroid, levothyroxine, or Synthroid has to convert into the active form. But the activation of those hormones that you're taking for your thyroid condition doesn't just happen in your thyroid gland. Let alone, let's not forget, 90% of hypothyroid issues is Hashimoto's thyroiditis. So merely taking the medication is not addressing the immune system. So back to what I was saying before, the conversion of thyroid hormone doesn't happen in the thyroid gland only. It happens in the heart, the gut, the liver, and peripheral tissue. The majority, the gut and the liver. So if you're dealing with any imbalances within the gut microbiome, you're dealing with a sluggish liver, meaning you have an overabundance of toxins, your body is overburdened with toxins, that will impair thyroid conversion no matter if you're taking hormone or not. So this is going to give you hypothyroidism. But you could be dealing with Hashimoto's, which is an autoimmune attack. Your immune system is mistakenly attacking your thyroid gland because it's sensing danger. Now, this danger is something called the cell danger response, CDR, coming from cellular inflammation. Now, majority of people struggle with good thyroid lab numbers, meaning on paper it looks good, but at the cellular level, there's inflammation and toxicity. So what that means is that the thyroid hormone can't get inside your body's cell to perform its physiological function. It's almost resistant. So yes, you're making enough thyroid hormone. You might be taking thyroid medication and it's getting inside you, but it's just not getting inside your cells. See, no matter if you're dealing with hypothyroidism, Hashimoto's, you have to get to the root cause, and just taking medication is not doing so. So what is the root causes? Nutrient deficiencies, number one. If you are dealing with any type of nutrient deficiency, no matter what, and remember this, all medications cause at least some form of nutrient deficiency. If you're dealing with any nutrient deficiencies in selenium, iodine, tyrosine, vitamin A, um, any of the B vitamins, this is all going to slow down your thyroid function. It is also going to dampen your immune system, which then is going to cause an autoimmune attack. Number two, poor gut health, poor liver health. If you're dealing with imbalances in the gut microbiome or you're dealing with a sluggish liver, like I had mentioned, it's not only going to cause slowdown in the conversion of thyroid hormone, but it's also going to cause inflammation and leaky gut, which intestinal permeability is leaky gut and has been shown time and time again to be a root cause to autoimmune conditions such as Hashimoto's. Toxins. Toxins is a broad term for things like mercury, lead. These are heavy metals. Also, things like mycotoxins. This is mold. This is things like glyphosate and pesticides. Things that they spray on your food. These are all things of toxins that damage your thyroid gland. It also causes inflammation, causes overabundance on your liver, which then therefore is going to cause thyroid problems, hypothyroidism or Hashimoto's. Chronic stress and inflammation, as we know, chronic stress suppresses your thyroid gland. It also suppresses your immune system. You living in fight or flight is destroying your health. These are all things we fix because we understand where you're at. We understand your physiology. Yeah, taking some vitamins and stuff like that is going to, maybe cause some type of marginal benefit, but it's not going to truly fix the holistic problem. That's what we do. So, hypothyroidism is not a disease, it is a temporary problem. And we found this out by the articles and the research by the School of Medicine, Yale, meaning that 21 million Americans taking levothyroxine don't actually need it. Matter of fact, they actually had symptoms that were worse. You can go find this. And what we found these studies is that people were dealing with seasonal hypothyroidism, meaning it was just a period of time where there was a suppression of thyroid hormone giving you hypothyroidism that then would give you that diagnosis. But later to find out that was just only a period of time. That happens when you're chronically low calorie dieting, when you're chronically not sleeping enough, when you're eating a bunch of inflammatory processed food, if you're over exercising. These things are all stresses inside your body. You're taking all these different medications. These are all stresses on your body that then will suppress your thyroid gland, which then will give you those symptoms: brain fog, hair loss, brittle nails, dry mouth, weight loss resistance. So, what can you do? Number one is to follow an anti-inflammatory diet, more so called the Mediterranean diet. The Mediterranean diet is going to have an overabundance of good antioxidant phytonutrients to help with lowering inflammation at the cellular level. It's also going to have a lot of good fiber in it, which is going to help balance out your microbiome. Because Studies also show that if you deal with SIBO or H. pylori, which are both bacteria overgrowth, meaning you have an overgrowth of bacteria in your gut, if you have any of those issues, that will impair your thyroid gland, giving you hypothyroidism. So fiber is going to help with that. Perhaps using a high quality probiotic in some cases, case dependent. The next thing you're going to do is remove the things that could be triggering the immune system, like a lot of food sensitivities, gluten, dairy, corn, soy, wheat. These are common things that are destroying your immune system because it's causing an antibody attack, because your body is sensitive to it and your immune system is. Okay? The next thing that I would suggest would be to use a methylated B complex, okay, and also use some fat soluble nutrient absorption help. So what does that mean? So using a methylated B vitamin is going to ensure that you have all the right B vitamins in you, because remember, if you're a woman and you've spent years on birth control, you've already depleted your B vitamins. So if you are taking a good quality B vitamin like methylfolate, it's going to help. And let's not forget, 40% of the population have an MTHFR gene, meaning they have poor methylation. So these methylated B vitamins are going to help with that. So if you take the high quality methyl B vitamin and perhaps you take some digestive enzyme support, pancreatic enzymes, bile, salts, hydrochloric acid, these are all things that you can take to help with the digestion and assimilation of nutrients while you're starting to heal and fix the gut. You're balancing the microbiome, you're removing things out of your body, you're reducing inflammation. This all will inevitably improve your thyroid condition, no matter if it's hypothyroidism or Hashimoto's. The next thing you should do is support your body with the adequate nutrients your thyroid needs. Specifically, if you're also just hypothyroidism, I would suggest iodine, selenium, tyrosine, vitamin A, and zinc. If you have Hashimoto's, I do not recommend iodine right away unless you test. Okay. Next would be to balance out your blood sugar. If you do not have good glucose regulation, you're not going to be able to convert thyroid hormone, let's say, adequately inside your cells at the cellular level because you already have insulin resistance. So you can do that by making sure you get adequate protein in and fat with meals, making sure that you are training and not overtraining, because that's a stress. Not overtraining, but making sure that you're getting the right, movement in. Okay. And that's going to move into the next thing, which is going to dramatically help your hypothyroidism, Hashimoto's, is to address your stress in adrenal glands. Many people are living in sympathetic dominance, is what it's called, fight or flight. You want to use adaptogenic herbs, cordyceps, copaiminary, magnolia bark, ashwagandha if you are dealing with Hashimoto's. These are all going to be great adaptogens to help with lowering and helping lower stress and have your body adapt to stress that it's facing on a day-to-day basis. Next is to support your liver. You can do this with milk thistle, but then also with citrus fruits. This is going to help with supporting your body to neutralize and excrete harmful substances, toxins out of your body. And the last would be to heal your gut. This is exactly what we do with all of our clients here at the Complete Vitality Functional Health Coaching Program. If you're someone struggling and you're ready to get back your life, reverse your chronic health condition, reverse your thyroid issue, and get to the root cause and lose 20, 30, 40, even 50 pounds of excess weight, and you want to get into your dream body, message me Thyroid today.